Namaskar.
No, just give
Good
me a
morning.
second. Give me a second. You start now. Whenever we're ready.
Namaskar. Jai Mata Di, Jai Sri Krishna, Jai Santoshi Mata. Today is again Friday, 29th of December. 2 days left for this year. So I am thankful to everyone who gave us company throughout these years. And we are going to join soon the new year with the same strength, with the same support for everyone. Thank you. आइए सीधा बैठिए. Next stage, spine straight, shoulder behind. मन सहज, आंखें बंद. ध्यान मुद्रा में बैठ के लंबा गहरा सांस लेंगे नाक से और मुंह से 3 बार पवित्र नाम ओम का उच्चारण करेंगे. ओम भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्. ॐ सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्. ॐ शान्ति शान्ति शान्ति. Everyone is welcome in this session, and we are going to do our yoga practice. Always follow your own body. Do as much your body allows you. Don't overdo it. Suffering from hypertension, heart problems, severe acidity, severe asthma, severe backache, be very gentle to your body. You have to do everything, but do slowly, whether that is your physical exercises, pranayam, or poses, asanas. You have to do all very, very slow. But we have to do it. If we don't do it, we'll be stiff, we'll be miserable, and the life won't be life. What is this yoga? Yoga is our life. This is our breath. We do every day to activate ourselves physically, mentally, spiritually, socially, emotionally. This yoga works like wonder, you know. Once you get into it, this is a big addiction. You can't live without it. Your body won't move if you don't do any yoga. So yoga is a must. Today I'm going to touch 2 more important points. One is your posture. We always say sit straight. If your neck straight, spine straight, shoulder behind. What you are doing, whether sitting, standing, lying down in your bed, the posture is most important. Why? If we don't have good posture, we are going to suffer physically, mentally. Examples I can give you so many. Going to the physical point of it, when you sit like this, what is happening? Your chest is getting small. There is not enough room when you are breathing in, because there is enough space there. for the lung to function properly. The poor diaphragm can't work. It's squeezed out. That's why it says sit straight and take a long deep breath. Now see, the whole chest is working, the expanding. Diaphragm is going down nicely. And all the elbow line where the air sacs are in the lungs, they are doing their work properly, interchange of the gases. That's why you should sit straight. And if you're going into hunch completely, you are down, you are gone. So that's why sit straight, shoulder behind. When we say shoulder behind, our chest also opens up. And other thing is, when we want to breathe, we can't breathe even if we are not sitting properly. Other thing is, you get very tired. You feel very tired if you are not looking at your posture. Sitting on a computer, mobile phone, or whatever you're using, sitting for a long time. And then when we are looking for a long time, we change our position also. We don't realize we are twisting our body. And that's where we are suffering. That's why people are getting a lot of backache. The ache can be from any part of your spine, the neck, the thoracic region, or the lower lumbar region. Anywhere the pain comes because of the bad posture. That's why they say if you have to work on the computer, sit properly at the computer should or the mobile phone be at your eye level. Sometimes we put our mobile down and we are going and looking for hours and hours. The WhatsApp messages are coming. Yes. So make sure it is at the eye level and don't look more than 20 to 30 minutes and then change. Maybe stand up, do some work in your kitchen. So much work to be done in the kitchen. Do that. Get up and do something, maybe for 10 minutes. And other thing is you get tired, you get backache, and you have low esteem, self-esteem. You feel very depressed. You feel very depressed if you don't maintain your posture. Because all the time you're looking at the earth, you're not looking straight. So there's more chance you may be knocking other people. That's what is happening when we're walking on the road, especially the young people. They are holding your phone, they're talking to phone, they are crossing and they're brushing your hair, they're everywhere. I had this experience 2 days ago in Oxford Circus, We went to see the lights, beautiful lights. I say everybody should go and see those lights. They are beautiful lights. They have done a very good job in whole central London. So this is very, very important, your posture. If you want to be happy and cheerful, have good sleep, and have more socialization done, if you are depressed sitting at home, you're not talking to your friend, you are all alone, and you're going to get dementia and a lot of other problems. So posture is very important. Sit straight all the time. So this affects us. That's why most of the time, whatever yoga we are doing, please sit straight, shoulder behind, raise your spine up, or if you have got problem at your back, the low back, just put thin cushion underneath your buttocks and sit straight. So this was about the posture today. This affects us completely. And you can diagnose problem of the person from their posture. Other thing is we are getting osteopenia, osteoporosis, no bone mass, we are getting short in height, and when we are not maintaining good posture, that's why, this Tadasana is very good. Tadasana is very good for your spine, for your stomach, for your legs, for your knees, for the constipation. It increases your height. So we are doing the Tadasana while sitting. Don't worry. Sitting also we can do. You can put your feet on your forefoot, raise your heel, and stretch. Tadasana is most important for the posture. Structural balance. Tadasana we are doing everybody while sitting. Doesn't matter, you can do your variation. When I stand up, I will do more. Same thing, you can do Triktadasana. There is a gap between your feet and you are moving sideways. Most of the exercise we are doing and the asana, they are for the structural balance. It increases our posture. See, you're getting more flexibility. Go down as far you can go at your own pace. Triktadasana. My feet are on the ground. Then come up again. The next one is for your spine. The width is shoulder width. And take towards the right side. You can move your neck also. You're doing your neck movement. Stay there for short time. Then breathe in. Come in the center. Stay there. Then breathe out. Go towards the left side as far you can go. Very good for your spine. Improve your posture. Then breathe in slowly. Come up. Again. Always come back to the center. That's most important. Right side I'm bending at my own pace. Then breathe in, come in the center. Then breathe out, go towards the left side. You are doing activation of all the organs of your body. Your heart, your lungs, your abdominal organs, your spleen, your kidneys, your liver, your gallbladder, intestine. All these movements are going to help me to even get rid of my constipation. Acidity also, we'll throw some gas. Then come forward. You're doing your neck movement also. Very good. The next one is while sitting, we are doing at your own pace. Good shoulder movement. Very good. For weight reduction also, we are moving our trunk also, chest and abdomen. Carry on at your own pace. हंसते हुए मुस्कुराते हुए enjoy करना every bit. Carry on. I am watching you now. Open up your video properly. There is haziness, Gita, on your video. Very good. चलते चलिए. Carry on, carry on. Your own body, your own strength. चलिए लंबा गहरा सांस भरते हुए नाक से. You are doing your भद्रिका प्राणायाम. प्राणायाम is our आधार all the time. जब तक ये हम जिंदा हैं, प्राण पिता हमारा प्राणपति हमारे साथ है. Carry on. Very good. Very good. The next one is half camel pose. You are sitting on the chair, again spine erect, shoulder behind. Put your hand at your buttocks and go back. Go back. Go back. See here. Spine is still erect. Yes. Breathe in and go back. Half camel pose. Ardh Ustak Asana. Very good for the whole body. For the spine, for the thyroid gland, parathyroid gland, vocal cords. And you breathe out and come straight. Once again, breathe in. Go back slowly, very slowly. Look at the ceiling. And breathe out and look straight. If you are very flexible, very active, young, then you can do the full camel pose, touching your heels. If anybody can do it, but don't overdo it. Follow your own body. To make full camel pose, you have to touch your heel when you're going back completely. For that, you need lot of flexibility. Everybody can't do it. Neither you try. No need. No need. Anybody can try that full camel pose? Let me see if Nani can do it. Anybody else can do it if they are more flexible. I am not going to. I will do half. I'm happy with my half. Now, first thing is you have to take your arms by the side, Nani. Take your arms by the side, stretch. Then take up while you're breathing in. Then bend, go back, go back, go back. Take your hands towards your heel. Take your hand, touch your heel if you can. Very good, very good. That is the way, that is full camel pose. And you're looking at the ceiling. Very good. Oh, this one has she's also done it. Very good. See, this is full camel pose. Well done, well done. Give them a hand. Okay, the next one, Ardh Chandrasana. We'll be doing Ardh half. You can do full. One hand in your axilla, other one on the shoulder. Breathe in and go back again very slowly. That's the idea. Don't do fast, slow, so that you give time to your muscles and ligaments to warm up. Otherwise, they will get annoyed and you get pain. Breathe in and go back. Look at the ceiling. And you breathe out, come back slowly. This is, I have done Ardh Chandrasana, half moon pose. These two ladies, lovely ladies, have done full moon asana. Puran Chandra asana. Once again, breathe in. Go back very slowly. Very slowly go back. Look at the ceiling. Stay there for a short time. To get the full benefit, we are supposed to stay in this position or any other pose we are doing, minimum 1 to 2 minutes. And if you want more improvement, you have to do for 10 minutes per pose. That is the idea of yoga, to get the full benefit. So slowly and slowly increase the duration. I'm sure in 1.5 sessions, you can't cover all the poses. Whatever you do for a long time. That's the idea. And if you look at your body, where the action is occurring, your neck, yes, you're going back, yes, then all this neck region, the face is going, neck is going. There are so many glands there, which are giving us lots of problem and they are not functioning properly. Hyperactive, thyroidism. Then thyroid doesn't work, low, myxedema. And then the vocal cords also, they need exercise. Then your throat. And then when you're doing like this, there's exercise in your mouth also, your gums, your teeth, the nose, eyes, ear, everything. Then coming down your chest, heart and lungs. And then the abdomen also. Get rid of extra fat and activate all those organs. And then the back you are giving, good for your spine also. So, whole thing. And the effect is going up to your pelvis. Yes, we can try again. And then visualize your whole body. Once we visualize where the effect is, we get more interested. प्यार बढ़ जाता है जब प्रीत हो जाती है ज्यादा, जब पता लगे क्या कर रही हो. So once again, Chakra Asana we are doing, and focus on your body. Breathe in and go back, still breathing in. Visualize the whole body where the effect is. Then you breathe out, look straight. Now while you are sitting, whole body is getting, and my pelvic floor is getting the effect. That's why we say sit when you're sitting. Sit like this. You're sitting on your sitting bones, isn't it? But where is the pelvis? Pelvis is there, which is like a hammock on which all the organs are sitting. Our intestine, your rectum, part of intestine, rectum, the bladder, the prostate, and what else? Uterus on the pelvic floor. That's why at this age there are lots of problems of prolapse. Prolapse. Many people are getting prolapse. They don't talk about it. Many people have problem with their incontinence, whether that is urinary incontinence or fecal incontinence. There is a leakage. This can happen at any age. If when we are born, if there is congenitally we have got problem, there, our pelvic floor wasn't very active. Even the children can get problem. And then when we grow up, and especially when we get pregnant, so much weight is going there. So there is more chance. And then when we grow up in the golden age, our whole things is getting low laxity, no collagen, no nothing. That's why people are having more problem. Unfortunately, the woman is getting more problem than men. But they are also getting. So prolapse. What is prolapse? Bulging down. Bulging down because my pelvic floor is very weak. Many people are going for various operations. But if you do yoga practice seriously for a long time, you can get better. There are so many techniques you can use. The simplest one is what we are doing every day, the Mool Bandh. Mool Bandh, the third lock, where we are squeezing the lower part of where the fecal matter comes, urine comes. Hold it tight. If you practice this, this is known as Kegel's exercise. Very important. Third lock is very, very important. There were two main subjects today, posture and prolapse. The pelvic floor, we have to look after it. Most of us suffering because of our age. Maybe some of us had difficult delivery. We were in labor for a long time. Yes, that can be the cause. Or we are too obese, too much weight on the body. So while doing this yoga practice, you are losing weight automatically if you are doing for a long time. Yes. So prolapse was the second topic of the day. So please now listen very carefully. You can do this mool band, which we do, and we request you to do it even doing any pose or sun. Do mool band, do mool band. And when you're lying down and you're suffering from backache, if you do Udyan band and the mool band at the same time, you feel so relaxed at your back. We can practice that later on if the time permits. But you can try yourself, lie down if you're suffering from backache, lie down, do mool band and Udyan band, the abdominal lobe. Just see what happens. Make sure you're touching the ground. Your spine, your back, whole back is touching the ground. Same thing when I'm sitting, even on the chair. I'm sitting, my legs are down, relax, and see, my pelvic floor is getting still. Some exercise. So this is one way to improve. Then there are various poses we do, you know. Some are very difficult. And I don't know if Mani can manage. There's so many poses you can do. So many poses you can do. So many. Now, who is interested to do those poses? Some I can do very easily. Some I can't do because of my knee problem. But I can demonstrate while sitting on the chair. The first pose is...
Which pose you want me to do? Sorry, first.
Now, just let me do first.
Okay.
Sitting on the chair, I will show you. Now, let's say I was standing first. Yes? Then many will be doing on the ground. I'm sitting on the chair. You can also do. What you have to do, mala pose. Your hands are first there. Then you come up like this.
Oh, okay. Right.
Mala pose. Mala asana. Mala asana. You got it? Now you can do Mani. Sit. Yes. Yeah, very good. No. First, sit straight. In Dandasana, demonstration will start from there. Sit in the Dandasana, sitting on the floor. That is the Dandasana.
Yeah.
Legs are stretched out. Hands are at your hip level. That is known as Dandasana. Now start doing Malasana. Now bend your knees. Sit on your feet. Feet are touching the ground. Hands are coming down like this. And then you do your namaste like this. Very good. Elbow should be inside as Mani has done. This is not a Mal Asana. This is, see, your pelvic floor is getting so much exercise. See,
Mani,
when we have
highlight
problem, the
Please
Eastern
highlight
toilet give
Mani.
us more relief because we give so much pressure. Western toilet, we have problem. Yes?
That's right. Yeah.
So this is one pose. Then the next one is you can do baby pose, child pose. I can also do that. That's no problem. Lying down, child pose. Child pose. Just going on your knees and on your hand. And then what the child do? He goes down like this. Like this. Child pose. Very good exercise for the pelvic muscles. Very good. Stay there for short time. And then repeat many times. So start 3 times, then maybe 10 times. Repetition, repetition. Then you come up. Okay. The next one is our cat and cow pose. See, very easy. Anybody can do it. Cat and cow pose. First is cat pose. Now, these asanas are helpful for any problem, like abdominal problem, you know. And Now I'm going to be cat now, looking down. And what is happening? There is a curvature on my spine. My tummy is coming down. My hips are going up. Pull your hips up. Many. Pull your hips up. Make a curvature of the spine. Pull your hips up. Hips up. Hips. Look, my hips up. Don't make straight hips. Then the pressure will come on the elevators, the pelvic muscle. No, no. Your buttock straight. Lift them up. Go down. Your tummy is coming towards the, facing the ground, and hips are coming up. Lift your hips more.
Can't do it anymore.
Hips up.
And then you go like this. That's for the cow.
Okay, never mind. Okay,
Yeah.
this is the cat pose. Now we are going to have cow's pose. When the head is looking up, cow's pose. Here my hips are not raised. Relax yourself, Mani. Relax. You're not bending your knees properly. Look at me. No, your knees are touching the ground. Bending knees. Very good, very good, very good.
Oh, you want to do this?
Yes, that's fine, that's fine. Now look up, look up, look up.
Yeah.
Very good for your thyroid gland, parathyroid gland, for your abdominal muscles, for the spine. So this is your, we are now cows. Gau Mata ki jai. Gau Mata ki jai. Everybody should say, Gau Mata ki jai.
Gau Mata ki jai.
Cat and cow's pose. The next one is on your back. Go on your back. Lie down. Just relax. The simple asana we do every day. Raise your right leg up, 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 90 degrees. Very good. Then bend more, more, more. Stay there for a short time. See how much action is occurring at your pelvic floor. That's the idea. Then breathe out and take your right leg down slowly, slowly, slowly. Another one up, slowly, slowly up, coming 90 degrees and further going back as far your legs allows you, depending upon your flexibility. Come on, stretch. Stretch nicely. Then take it down slowly. And if you are not suffering from hypertension, heart problem, very weak, raise both the legs up. Come on. And take them as far. This is known as halal asana. Come on, more back. Get the help of your hand at your knees if you're not very flexible. Take it down. This is the halal asana. See how much pressure is coming on the pelvic muscles. Very good. Hold it. Again, 5 seconds, 10 seconds, 20 seconds, maybe 1 minute. Yes, slowly and slowly increase the duration. Very good. Take it down. Take it down. Slowly. Very slowly. To activate the muscles, the elevator one. Then again, you can do, take it up and give a nice rotation. That's what we're doing every day. Every day, rotation. At your own pace. Then anti-clockwise. You have to go slowly, but as time doesn't permit, other one is gone up, give a good rotation. Idea is we're giving a lot of exercise at our the muscles which are on the pelvis. Okay. Another one very important here is our, same goes for the Uttan Padasana. You can do both together. Always start with the right, then left, and then two together. Hold it for a long time. Very good for various things. For Nadi Dharan also, weight reduction, activation of all the organs and the muscles of my pelvis. Then take it down. Then your Lokasana, that will help me. Very good. Relax. Next one is Setu Bandh Asana. Bend your knees. This will help a lot. Breathe in, go very slowly up, very slowly. Raise your spine up. Very good for the prolapse, the leakage. Hold it for a long time. Setu Bandh Asana. Good for the spine, for the abdominal muscles, weight reduction, so many benefits. Carry on, raise more at your own pace. Enjoy yourself. Full attention is on my pelvis muscles, which are holding my uterus, rectum, bladder. Hold it. Hold it. Enjoy yourself. Go on chanting inside. Om Namo Narayana. Om Namo Narayana. Om Namo Narayana. Hare Krishna. Hare Krishna. Krishna Krishna. Hare Hare. Hare Rama. Hare Rama. Rama Rama. Hare Hare. Hare Krishna. Hold it. Then only the effect will come. Long duration for one pose. Hare Krishna. Hare Krishna. Krishna Krishna. Hare Hare. Then breathe out and come down very, very slowly. Take your legs down, relax. Just relax in the Shavasana. We have to do still more poses for the prolapse, for the incontinence. Do the Mool Bandh now as you're lying down. Do the Mool Bandh. Squeeze the muscles on the sitting bone. Come on, squeeze. Squeeze. As you're lying down, you can experience for the backache. Do Udyan Bandh also. Get rid of the backache. Enjoy करिए, लेटे रहिए, प्रभु को याद करें. Very good. The next one is bend your knees, join your soles up. This is very good. Again for the, as one of the pelvis exercise. आराम से लेटे रहिए. Join your soles, bend your knees, Bend your knees, join your soul, pull down your knees, pull down your leg, knees down, knees down, knees down. Watch me, please. Watch me. Money, watch me. My knees are coming down as we do
I
on
see.
the
All right.
butterfly,
Yeah.
joining our soul. Knees are coming down. Watch me, dear. Watch me. Look. My souls are joining. Souls are joining. My knees are touching the ground. And lie down in that pose for a long time. This is very good. Very good. Good relaxation. Join your soul. Knees are first bent and then take them down. Like butterfly we do, you know, that pose. This is very good for the pelvis. For the hips. Relax. The next one we will doing is threading the needle. Bend your left knee, then right knee, and put your foot on the knee of the left leg and push it down. Put your hand underneath and try to bring your thigh of the right leg up, known as threading the needle pose. Very good for the again, for the hips and the pelvic floor. Then relax. Do other side. Left foot is coming on the right knee and holding in between my left knee. Stay in this position. Multiple benefits for the arms also, for the shoulder, for the hip, for the knee, and the pelvic floor. Then relax. Next one is we do every day, every day. Pavan Mukta Asana. Very good. Bend your right knee, hold it, bring it close to your chest. If there is no neck problem, you can bring your nose close to the knee. Hold it for a short time. Then take it down. Other one, left one, slowly. Breathing in, holding close to your chest. Bring the nose close to the knee. Hold it. Then down again, very slowly. Now we can do both the knees if we are quite active, not very weak, no hypertension, no heart problem. Hold both of them. I am holding at the back because of my knee problem. And hold it like this. Squeeze on your abdomen. Squeeze. Pavan Muktasana is very good for the pelvic floor as a part of exercise. Hold it. You can hold 10 seconds, 20 seconds, 30 seconds, maybe up to 10 minutes in one position to get rid of all this gas also for the constipation. And then you can rock. If any air is stuck anywhere, get rid of that. Forward and backward. Sideways. Very good. Very good. Hold it like this. 1 minute, 2 minutes, 3 minutes. If you are suffering from prolapse, slowly and slowly work out up to 10 minutes. Morning, evening, empty stomach, anytime. Whenever you think of your pelvic floor, just go on doing it. Provided it's empty stomach. See, these are the most important exercises. Try to hold it. Try it. Just hold it. And take your attention on your prolapse or urinary incontinence, fecal incontinence. There we are, friends. So this is all about, try to hold it, hold it. Hold it without any movement, just hold it. And full attention is on your pelvic floor muscles. So we have done a lot of exercises touching the topic of prolapse. Again, if you had surgery recently, please don't do it. Only do it after you have your follow-up and if your doctor says you are recovered. Otherwise, please be very gentle. So as you can't do much after operation, yes, then concentrate on pranayama more. Concentrate on pranayama more. And once the doctor says there is a good healing, you can start very, very slowly. Don't overdo it. I am talking about after surgery. After surgery, you have to be careful. But this is for the people who are doing as a preventive measure or they are suffering from prolapse. But after surgery, one has to make sure that they have discharge and they had a good recovery. It might take more than even 6 months, I think, for the repair of your prolapse. It might take, because at this age, our recovery is very, very, very slow. Don't worry, you can do lot of pranayam. Pranayam you can do. Now coming to the pranayam now, oh, time is already running. So there are so many steps we can do in pranayam not to get prolapse. Even if we have got prolapse, we can get better. And after surgery also, you can do some steps of pranayam, not all the steps, not all the steps. Coming to Kapalbhati, we say, na, after major surgery, that is a major surgery because that is down below. It is not the face surgery, it is down below. So you, Kapalbhati, you can't do 4 to 6 months or even after 6 months. If there is not proper healing, you can't be able to do any Kapalbhati. Okay, so this is very, very important. I'm just touching the point according to the information I got. So now we are going to switch over to our pranayama. You can sit in any position, sitting on the chair, sitting on the mat. Be comfortable. Go on breathing from the nostril, exhaling from the mouth. Carry on. Pranayama is first and the foremost. If you can't do any physical exercise or asana, spend all the time on pranayama. Everybody knows the 8 steps of pranayama. Yes? Bhadrika, first, second Kapalbhati, then come Bahari Pranayam, then Agnisal Kriya in between, that is just a Kriya, action, and then comes Ujjayi. They are all very important. But again, you have to make sure which one you can do according to your own condition. Then come to Anlom Vilom, Bhamri, Udgit and Pranav. Bhamri, Udgit and Pranav we do in the last. Idea is to get rid of all the physical problems and go the ultimate stage of Samadhi. That is the meditation. We do Ashtanga Yoga. So let's sit straight now. Again, posture is coming up. Good posture. Next state, spine straight, shoulder behind, मन सहज, आंखें बंद. ध्यान मुद्रा में बैठ के करेंगे अपना deep breathing in and out. Again, depending upon your experience, practice, you can do for 2.5 seconds in inhalation and exhalation also 2.5 seconds. But as we are doing for a long time, we can increase the duration. Be comfortable, whatever you are doing. Follow your own body. Face पे smile. The oxygen is going to every cell of my body to activate me, to get rid of all the problems. All the systems are getting activated. Face पे smile. We are doing Bhadrika Pranayam. लंबे गहरे सांस अंदर और बाहर. सांस जब अंदर लेते हैं तो उसको कहते हैं पूर्वक, जब छोड़ते हैं तो रेचक, जब होल्ड करते हैं उसे कहते हैं कुंभक. बड़ी केयरफुली होल्ड करने, डिपेंडिंग ऑन सर्टेन कंडीशन यू कांट होल्ड योर ब्रेथ. So just simple breathing in and out at your own pace. अंदर ही अंदर जाप करिए. कोई धुन, कोई शब्द, कोई चपाई, कोई दोहा. प्रभु के नाम का सिमरन सतत. Fix your videos, please. Fix your videos. आपके दर्शन होने चाहिए मेरे को. अब नेक्स्ट करिए विद द खिचड़ी मुद्रा. खिचड़ी मुद्रा लगाइए एंड ध्यान रखिए अपना थर्ड आई पे. फिर देखिए कोई डिफरेंस फील होता है आपको. लंबा गहरा सांस. स्लोली स्लोली. जिन लोगों की कोई भी सर्जरी हुई है, भद्रिका प्राणायाम करिए. देखिए आपकी हीलिंग एकदम फास्ट हो जाएगी. क्विक रिकवरी. क्योंकि हम अपना ऑक्सीजन बढ़ा रहे हैं, विच एक्ट लाइक मेडिसिन फॉर हीलिंग. और जब साथ में जाप करते हैं तो उसका तो बहुत ही फायदा है. सबसे बड़ी औषधि है प्रभु का नाम. जाप करिए. ओ ओ ओम नमो भगवते वासुदेवाय. ओम नमो भगवते वासुदेवाय. और अपना ध्यान ले जाइए जहां आपको प्रॉब्लम है. डायबिटीज है तो पैनक्रियास को निहारिए. वहां ले जाइए अपना ध्यान. वहां जाएगी ज्यादा ऑक्सीजन. जब हम टच हीलिंग करते हैं तो अपना हाथ वहां ले जाते हैं उस पर्टिकुलर एरिया पे, उससे भी हमें पावर मिलती है, प्राण शक्ति बढ़ती है वहां से टच करने से। इन उंगलियों में बहुत पावर है, टू मच प्राणा इज देयर। जस्ट कॉन्सेंट्रेट। आपकी कोई रिकवरी हो रही है किसी सर्जरी की, जस्ट गो ऑन डूइंग भद्रिका प्राणायाम, सिंपल। कोई टेप लगा लीजिए भजन का, उससे आपको फायदा होगा। संगीत में योग। ओम नमो भगवते वासुदेवाय, ओम नमो भगवते वासुदेवाय, ओम नमो भगवते वासुदेवाय, ओम नमो भगवते वासुदेवाय। Keep your neck straight. Don't lift up. Straight, just straight neck. Carry on. Very good. You're doing very well. Carry on. Now raise your arms up. Rub your palms 15 to 20 times to generate heat. Put it on your eyes. थोड़ा सा प्रेशर दीजिए। आपकी हथेलियां जो है वो टच कर रही हैं आपकी आईज को। To give all the warmth, the energy to your eyes to get rid of any eye problem. Watery eye, discharge from the eye, pain in the eye, glaucoma, cataract, double vision, color blindness. Soothing effect on your eyes. When the hand temperature is equal to the face, you can open your eyes slowly, remove the hand, and you can massage at the lower eyelids to get rid of these black patches. We are all getting that. A little bit swelling also there, puffiness. उसके भी कई कारण हैं, Then the lateral angle of eye, very gently. Then the medial angle of the eye. Then coming down, वहां पर एक डक्ट है, nasal lacrimal duct. जो आंसू आते हैं तो नाक से निकलते हैं, अगर ब्लॉकेज होगी तो वो निकलेंगे नहीं, आंख में ही रहेंगे। साथ में you are activating your sinuses also. There are two sinuses there. Then करिए इसको मैग्नेट साइनस को भी। जिनका नाक बहुत ब्लॉक रहता है ना, try to do this. Then the temple region. Take away all the stress. Plus you are activating your major nerve known, very big nerve. They are giving a lot of problems. Trigeminal nerve. Then come to this point. Activation of the pineal gland. Pineal gland is controlling our sleep. And we are activating our Agya chakra. And then do like this. Here are the frontal sinuses. उसको हम कर रहे हैं. Then rest of it, pretty hard to get rid of these lines, the wrinkles. काफी आ गए हैं इस उम्र में. आने दो. भगवान का शुक्रिया इस एज में हम पहुंचे कि हमें रिंकल्स पड़े. Then over the head, come down, one finger in front, one behind. Behind the ear, lots of glands we are activating. Lymphatic system. Coming to your throat. अच्छी तरह इसको करिए. Then thyroid gland. Behind 4 lobes of parathyroid gland. नीचे आ जाइए. Thymus gland, which is very important. इसको press करिए. Take away all the grief and increase the immunity to fight against any virus, any bacteria, any fungus. प्यार के साथ. Then you can do any part of your body where you're having problem. Nice tapping you can do anywhere. Anywhere you can do. And do this freeze, which is very important. Freeze at junction of your upper arm and the lower arm. Here. दूसरी तरफ करिए. ताड़ियां बजा के भी कर सकते हैं. इस समय हमारी बॉडी काफी एक्टिव हो चुकी है. हमने बहुत किए हैं पोजेस. आप नीज में प्रॉब्लम है तो उसका भी करो. व्हाई नॉट. और अपनी वेगस नर्व को और एक्टिवेट करने तो मारो. काफी एक्ट योर अम्बिलिकस. वजन भी गिरेगा इससे. वेगस नर्व भी एक्टिवेट करेगी. पैरासिम्पैथिक सिस्टम. मेक मी कूल एंड काम and increase my digestion also. लगे रहो जहां तकलीफ है. अब किडनी को जरूर करना है. वो को हमेशा भूल जाते हैं हम. इसको करिए ताकि हमारा ये फंक्शन ठीक रहे. किडनी फंक्शन. वेरी गुड. वेरी गुड. लगे रहो. अपनी बॉडी है. हाँ जी. मारा खूब अपने आप को. वेल डन. चलिए आगे चलते हैं. अब नेक्स्ट वन इज कपालभाति. Precautions are very important. Again, I will say, after major surgery, you are not supposed to do for 4 to 6 months. Before you start, always consult your doctor if you're suitable to do it or not. All right, or your yoga teacher, she can tell you also. But the full history is with your GP. That's why we don't get involved. We say, ask your doctor advice, please, because they know you better. Hypertensive heart problems, severe acidity, severe asthma, recovering from any ailment, you can do it slowly. Slowly you have built up yourself. Bleeding from anywhere, severe headache, don't do it. If you're pregnant, don't do it. If you're trying to get pregnant, please don't do it. So these are very, very important. If you're suffering from any fits, convulsions, some people are suffering from epilepsy, don't do it. So we do Kapalbhati, we do with various mudras or with acupressure points. So we will do with some mudra. So please be careful. As I said, all the precaution we do according to that. And then again, I will say, as most of us now knows about most of the mudras, you are welcome to change the mudra if you want to change, depending upon your condition. Like if you are hypertensive, so make sure you're not using those mudras which is going to increase your blood pressure. That's why the safest mudra I will say is Pran mudra, of course. Then come your Apan Vayu mudra. That covers for everything. All the systems are activated. So let's start first with Pran mudra. Increase our prana shakti, plus good for the eyesight. 1 stroke, 1 second, the full attention is on exhaling. So automatically we are breathing in. Again, keep your neck straight, spine straight, shoulder behind, man sahaj, face pe smile. First breathe in, then breathe out, and full attention will be further on breathing out from the nostril. Again, there are 3 speeds, slow, medium, and fast, but please don't use fast speed on the Zoom. अंदर ही अंदर जाप करिए प्रभु के नाम का. Let's change over to Apan Vayu Mudra. Vayu Mudra, Apan Mudra. This will cover all the system, plus it will lower the blood pressure also. Get rid of all the breathlessness. We are all suffering from various problems. Lipids problem, kidney problem, thyroid problem. Take away all the poison of the body. Detoxification. Kapalbhati itself is a detoxifying pranayam, the king of pranayam, Kapalbhati. Plus with the mudras, we are getting extra benefits. And make sure the whole abdomen is moving. The upper part, middle, and the lower. Good for the pancreas to get rid of diabetes. Plus, not to get pancreatitis. That is another problem which is coming up. If people drink too much alcohol, especially during the festival time, they drink so much, these young ones. They're going to get what? Acute pancreatitis. To activation, whole pancreas function. Then the liver, fatty liver, cirrhosis of liver, hepatitis, cancer of liver. The spleen is getting activation. Whole digestive system, the stomach, duodenum, jejunal, small intestine, large intestine, the rectum and the anus. Effect is going up to anus. Not to suffer from hemorrhoids, the piles, anal tag, anal fissure, anal fistula. Glow coming on the face. Activation of thyroid gland, parathyroid. Whole system, heart and lungs getting better. Even the asthma is getting better. Even your allergic rhinitis, you are using decongestion like various sprays on the nose. Try to do more Kapalbhati and Alom Vilom Bhatrika. Yes, you are getting the answer, mister. And do steam inhalation also. That will help you. Yes, got the answer, mister? Where is he gone? Yes, you got the answer? Harish ji, you got the answer? Yes. Inhalation, steam inhalation, do that also. Increase Kapal Bharti, Anulom Vilom Bhadrika. The allergy will, you are suffering from allergy. The allergy will disappear. Energy will come. Energy will come. Try to do inhalation in the morning when you get up. Even you can do Jal Neti also, but I won't recommend. I don't know how much you know about it. Though Shravanji has explained many times before. Jal Neti. But again, one has to be very careful. What water you take in, you have to throw out the whole lot. So that's why I can't say that today. Maybe we can arrange another session because these things are done under observation. When I can see you and show you. So please do steam inhalation. Boil up the water, put your head down, breathe in from the nose, exhale from the mouth. Okay? Breathe in from the nose, sometime, maybe 1 minute from the nose, exhale from mouth, then reverse it, breathe from the mouth and exhale from the nose. That will clear up all your nasal passages. Try to do this. And I'm sure you will cut down on your sprays which you are using for your nose. But don't stop it. Don't stop it. Try to do this seriously. Long time, pranayam, those steps, plus steam inhalation. Thank you. You got your answer? Thank you. Thank you very much. Well done. चलिए करिए कपाल भाती करते जाइए. इस समय आप और क्या कर रहे हैं? You are doing your मूल बंद at the same time. The third lock for the prolapse, for urinary tract infections. मूल बंद लगाइए साथ में. चलिए आगे चलते हैं. The next one is Bahiri Pranayam. This is the one which is going to help me for my prolapse, for the incontinence, the Mool Bandh. So we are going to breathe in first. Again, suffering from hypertension, heart problem, very weak. Please don't do it. Bahiri Pranayam. Only do Anulom Vilom and Bhadrika for the time being. Okay? So breathe in. First, relax yourself completely. Breathe in, breathe out fully. Then do the locks, Udyan Bandh and the Mool Bandh. And the third one be the neck band bandh if there is no neck ache. Okay? Here you're holding your breath. How long to hold depends upon your practice. Can't hold anymore. Release the first one, the neck one. Release this one, then the Udyan and the Mool Bandh. Now for prolapse is the Mool Bandh most important, which you can do anytime. Sitting, standing, talking on the phone, even, yes, I am doing it. I'm while talking. Do the Mool Bandh. This you can do anytime. You are doing it. I'm watching you, my friend. Do your Mool Bandh. Relax yourself. Squeeze the muscle on which you are sitting. Squeeze them in. Hold it. Hold it. In the beginning, if you're a beginner, just hold for 3 seconds only. Don't hold for longer. If you're a beginner. And as the time goes on, you can hold for 5 seconds, 10 seconds, maybe 15, 20 seconds. Or maybe half a minute. Yes, why not? While I'm talking, I'm holding. This is very preventive for your prolapse and any incontinence. Sitting you can do, standing you can do, talking you can do, only you can't do when you're walking. You can do it in your bed also. Yes, we are all holding Moolban, very good. Well done. Now relax. So in Bahari Pranayama, we do 3 of them. But if you are suffering from those conditions, please do the Mool Band all the time. Again, beginners start off with 3 seconds only, and you can do your repetition throughout the day. So easy. Talking to your friend on the phone. I want to go to toilet, but the phone is ringing. It may be important call. We hold ourselves. So easy. Same thing. Got the point? Yes. Nod your head if you got it. I can see your smile. I can see your smile. Sorry. We are doing quite well on the Zoom. So we have touched that. Now here I won't say to do Ujjayi Pranayam. Don't do Ujjayi Pranayam as you are recovering from your operation. Don't do Ujjayi Pranayam. Okay? But, and don't do even Agni Sal Kriya. Don't do it. Okay? Ujjayi Pranayam is quite strong, you know. It is very good for various things. You all know that. The next one is most cooling activation of the whole system. All the arteries, all the nerves, Anlom Vilom. Do Anlom Vilom for a long time. And do your Chintan inside. Go on thinking of Lord, whatever you believe in. Anlom Vilom. धीरे धीरे सांस अंदर भरिए, slowly and slowly. Again, the beginners can do 2.5 seconds in and out, same duration. If you are doing for a long time, do for a long time, 5 seconds, 10 seconds. In and out, maybe longer than taking in. That comes with practice. Slowly. And there is a very little sound while doing Anlom Vilom. That is the difference from Nadi Shodhan. That is a soundless, plus we hold our breath. After breathing in, we hold and then exhale. That is the difference. Do simple Anlom Vilom. Here we are balancing our brain, you know, the right and the left brain. Because we are activating our Surya Nadi and the Chandra Nadi. And then when we do Anlom Vilom, the Sangharshan will occur and Sushma Nadi will be Jagrat. That's how we are getting so much energy. The 3 nadis are there, left Ida, right Pingala, and Sushma center. When we do this Anlom Vilom, there's a lot of Sangharshan, rubbing in between that activates, which go and join here in the Agya Chakra. Keep your neck straight, spine straight, shoulder behind. Well done, my friends. The next one is, I'm just going to touch because time doesn't permit, but to just make this complete. There are many asanas which are going to help us our pelvic floor. Very simple, you all know that. First one is Gomukhasana. Okay. This is very good for the pelvic floor. For various other organs also like shoulder. So Gomukhasana. Gomukhasana. Aram se. See how much pressure is coming on your pelvis. So this is very good for the prolapse. And you can do Kapalbhati also. And the Moolban. Yes. Relax. Sorry, we are moving fast, which I don't like, but I have to do it. Yes. Relax. Next one is Shashakasana. Breathe in, up, go down. We have done the child pose while on the ground. This is Shashakasana. Khargosh, rabbit pose. Can do Kapalbhati one. Then go up slowly, up. And you are touching your buttocks on the chair nicely and do Kapalbhati. Well done. Relax. Vakarasana is the next. Right bend, right knee bend, left is stretch out, holding like this. Right hand going behind. Relax. Other side, left knee is bend. Right leg is stretch out. Go as far behind you can go. Then breathe in and look straight. Yoga Mudrasana, very good. Breathe in, breathe out. And look at the ground. Imagine your chin is touching the ground. This is best done in Padmasana. Full attention is on my pelvic floor. You can do Kapalbhati we are doing. Then come up slowly. Second pose. Hold the hand at the back. Breathe in, breathe out. And lift your arms up. How much pressure is going on the pelvic floor? Breathe in. There we are. So some asana you can do. Bhamri pranayam 3 times. Udgit 3 times. Om. 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 Pranava. We are in the state of silent meditation. Fix your mind either on the breath or the third eye. Go on chanting the Lord's name inside. इसको लंबा टाइम करना चाहिए. अंदर ही अंदर कहिए, मैं अकेला नहीं हूँ. मैं अकेला नहीं हूँ. वो सर्वशक्तिमान सदैव मेरे साथ है. उन्हीं की अपार कृपा से सब कुछ हो रहा है. सब कुछ हो रहा है उनकी कृपा से. मेरा आपकी कृपा से सब काम हो रहा है. कोटि कोटि बार धन्यवाद. कोटि कोटि बार धन्यवाद. Lay your arms up, rub your palms. Put the palm on your eyes. Slowly open your eyes. Remove the hand. Oh,
Thank you.
चलिए एक बार कर लीजिए, एक ही बार, क्योंकि I have to leave soon. Okay?
Thank you.
Sing the song. Ah. यार एक ही बार होता है आज.
Thank you.
सर्वे भवन्तु सुखिनः. सर्वे सन्तु निरामयाः. सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःख भाग् भवेत्. ओम पूर्णमिदः पूर्णमिदं पूर्णात् पूर्णमुदच्यते पूर्णस्य पूर्णमादाय पूर्णमेवावशिष्यते. हरि ओम तत्सत्. हरि ओम तत्सत्. हरि ओम तत्सत्. ओम शांति शांति शांति. Thank you very much, my friends. I'm
Thank
sorry
you.
I have to leave.